Born Elaine Lippert in London, England, the third of 4 children. Elaine came over on the Queen Mary to New York in 1939, and at 15 years of age, graduated high school. After marriage and raising 4 children, in 1970, Elaine received her master's in social work and began working at the Council of Jewish Women as a caseworker.
When I first went into the helping professions, I always wanted to do something that would make an impression, that would make a difference. And I knew I wanted to do it with children. I didn't think at that time it would be teenagers.
In 1972, Dr. Leader began working at Cedars-Sinai Medical Center, where she became coordinator of adolescent group psychotherapy training after she started conducting adolescent group therapy sessions.
I found my niche. I found something I had enjoyed doing. It didn't seem like a job. It seemed very interesting, working with teenagers.
It was in 1979 when Elaine, Dr. Terry Lipton, and Miguel Ramirez realized that the teen-to-teen interactions were even more therapeutic than the therapist's interpretations.
And out of that experience with the adolescent group came the Teen Line.
April of 1981, 35 years ago today, the first call came into the only teen-to-teen hotline in the country.
Southland teenagers have a special hotline they can call to talk with other teens about their problems.
Hello, Teen Line.
At Teen Line, teens talk to teens.
That's the idea behind a breakthrough program that is literally saving teenage lives.
We try to prevent serious problems from erupting.
Founder Elaine Leader says she created the Teen Line because too many teenagers are not getting the listening ear they need.
What's your name?
We've made it very clear through the training that listening is therapeutic.
How old are you?
And if you know how to listen, you can be helpful to another person.
There's just so many calls we get. I mean, they range from, like pregnancy and relationship calls to suicide or, child abuse. I mean, we get everything in between.
Elaine's knowledge of adolescence became widespread.
In talking about suicide today, we're also going to be talking about suicide prevention. We're going to be talking about the impact on the young people and the impact on the families.
Today, Dr. Elaine Leader.
During our nation's most violent crisis in the 90s, it was Dr. Leader who was called upon to help us understand the shootings in Littleton, Colorado.
Feel trouble before it gets to a crisis.
There is nobody else in the world like Dr. Leader.
It's better to err.
If there's been a tragedy in the community, she's the first person to say, I'm here for you, I want to help you, how can I help you? And people recognize that.
Elaine's quest to educate the community on teen suicide prevention led to her involvement in community policing, training law enforcement how to intercede with suicidal teens and their families.
So sorry that after you tried to...
Teen Line has reached millions of teens through the hotline, the website, and community outreaches. Over 2,000 teens have been trained to become volunteer listeners on the hotline.
Anybody getting hurt?
I think Teen Line is among the best, if not the best, suicide prevention program for young people in Los Angeles County. Elaine Leader is a hero and should be considered a hero in this community for the time and effort she puts into this program.
And I think it's just a tremendous program, and Elaine Leader is at the center of all the goodness that has come from helping teens across the United States and internationally as well. And I couldn't do my job without her.
My legacy is to see this work of teens helping teens continue.
Teen Line thanks Dr. Elaine Leader for 35 dedicated years.